If you have difficulty in emptying your bladder, you may need to use a catheter multiple times per day to empty your bladder. This is called intermittent self-catheterization. This video will show you how to use your intermittent catheter. Let's first understand your urinary system and where urine comes from. Your kidneys filter the blood in your body to produce urine. The urine travels from your kidneys through two tubes called ureters to your bladder. When your bladder is full and you need to urinate, you relax a muscle at the base of your bladder. This allows the urine to pass out of your body through another tube called the urethra. In some cases, an intermittent catheter may be needed to empty the bladder. If the bladder cannot be emptied completely through normal urination, it can be drained by inserting a thin tube up the urethra and into the bladder. The tube, called a catheter, is removed when drainage is complete. This is called intermittent catheterization. The Magic3 intermittent catheter is made of 100% silicone. It's soft and designed to be gentle on delicate urethral tissue. It has an ultra-soft outer layer designed to help maximize comfort, a firm middle layer for easier handling, and a pliable inner layer for easier navigation. The catheter is available in different diameters or French size and lengths. The catheter tip is tapered and has 4 comfort-sized drainage eyes for ease of movement over sensitive areas. Urine flows into the catheter tip through the 4 drainage eyes. Your catheter may have a coude or bent tip. This may allow for easier insertion if you have an enlarged prostate or a urethral stricture. Urine flows out of the catheter through the funnel-shaped outlet. The catheter's outer surface may or may not have a coating on it. It is available with a hydrophilic or water-loving coating that, when wet, creates a virtually friction-free catheter insertion and removal. The catheter is also available with an antibacterial coating. The Sure Grip insertion sleeve allows you to hold the catheter firmly without touching its surface. This helps minimize the risk of contamination. To use a Magic3 hydrophilic intermittent catheter, you will need a catheter in its unopened package and materials to wash your hands and penis. Step 1. Wash your hands with soap and water and dry them. Step 2. Do not open the catheter yet. Before opening it, you will need to release the sterile water to hydrate the catheter. Here are a couple of options. Squeeze the foil packet between your fingers and thumb to release the sterile water. Or you can also release the water by bending the foil packet in half and squeezing the foil packet. You can place the catheter on a surface and use your hand or elbow to release the sterile water. Tip the catheter package end to end 3 to 6 times. Make sure the entire surface of the catheter is wet. Peel open the package at the funnel end just enough to expose the funnel. Don't remove the catheter yet. If desired, use the adhesive tab at the funnel end of the package to stick it to a nearby dry vertical surface while you prepare to catheterize. Step 3. Wash the tip of your penis using a washcloth or wet wipe. Step 4. Wash your hands again with soap and water and dry them. You can insert an intermittent catheter from a number of different positions, such as sitting or standing. Your healthcare provider will work with you to find the best position. Step 5. Hold the insertion sleeve in your dominant hand and squeeze it to grip the catheter. Remove the catheter from its package. Using your other hand, grasp the funnel end. Slide the insertion sleeve down the catheter until it is about 6 inches from the tip. Let go of the funnel and lift your penis up near the tip of the catheter. If you are using a coude catheter, make sure the bent tip is pointing upward. The notch on the funnel end will aid in showing you the direction of the bend. Using the insertion sleeve, hold the catheter firmly and gently pass the catheter tip into the urethra until the insertion sleeve nears the tip of your penis. Continue inserting the catheter with the insertion sleeve until urine starts to flow out of the funnel. Try to stay relaxed when inserting any catheter. If you feel resistance, just stop for a second, take a deep breath, and gently resume insertion. If you feel tense, the muscle in your bladder may tighten and make it difficult to insert or withdraw the catheter. Step 6. As soon as urine starts to flow, point your penis down toward the toilet or other collection device. If you cannot reach the toilet, a collection device or extension tubing can be used. When urine stops flowing, slowly begin to withdraw the catheter. If urine starts to flow again while you're removing the catheter, stop until the last drops have drained. Step 7. Finish removing your catheter. And dispose of it and its packaging into a wastebasket. Do not flush the catheter down the toilet. Remember that a catheter should only be used one time. Finally, wash your hands again with soap and water. For more information, visit us at bardcare.com and join our community. Intermittent catheters are intended for use by adult and pediatric, male and female patients for draining urine from the bladder. Reuse of a single-use device may create a risk of patient or user infection, compromise the device, which may lead to device failure and/or injury, illness, or death of the patient. Please consult product labels and inserts for more detailed safety information and instructions for use.